Gallimera. Good morning. And as you can see, we got chickens in the house this morning. Let's get the lovely Dorothy. Come on, lovely girl. Out you go. There's a good girl. Out you go. Yeah, she's been coming in and feeding with the guys and girls. Go on, off you go. She's our oldest chicken, aren't you, darling? We've had you here for at least maybe, I think about 3 years now. As chickens go, she's quite an age. Anyway, let's show you the weather. Yes, can you believe this is the weather today? It is wet, it is horrible, it's raining as I speak, and as I look over the hills towards the northern part of the island, up to those areas up there, I can't even remember the name of the areas up there now, Pigadakia and all those little sort of type of places along there, it is cloudy and horrible. Thank you to Amanda for a weather forecast today. She did actually say, all change the weather today. She said it's actually going to be 19 degrees Celsius, but it's going to feel like 16. So that's the weather today. Grim, miserable. Can't believe this weekend the weather's been so lovely. So as you can guess, no washing has gone out this morning, that is for sure. However, I am seeing a little bit of sunshine just round the bend there. If you look there, looking towards Laguna, you probably can't see it very clearly, but some sunshine is on the way. And also a big shout out to the lovely Shane Bowen, who's looking in at the moment from Exmoor. This is probably what it's like where you are in Exmoor at the moment. And also Amanda Gregory is just up the road. Thank you again for your concise weather forecast as well. Right, there's been quite a bit been going on within the last 24 hours. Here in Greece. Let's just quickly have a look at the infection rates for the last 24 hours and see how that's been going. Well, at the moment, I've got to be honest, the infection rates have been decreasing. Yesterday, I reported 5,991 new infections across Greece. Today, I can report 4,018, bringing the grand total since the pandemic started up to 878,920. There's been 10 new cases identified at entries into the country. That's up on the day before, where we had 4. Now, islands of interest. What I've done here is I've put together the last week's numbers of infections for the islands across, basically, just to see the difference between that and the week before, to see if we can see any drop in infection rates. Well, at the moment, Lefkada had 9 new infections reported yesterday. That means they've had 54 infections total last week against 88 the week before, and that island at the moment is in the green. Now, Corfu, they had 43 new infections. Their total for the past week was 655 infections on that island, which was up on the week before, where they had 567 infections total that week, and that island at the moment is still in the red. Now, as for Kefalonia, they had no new infections recorded yesterday, which was a positive. However, over the last week, they had 44 new infections. That number is down on the week before, where they had 71 infections, and they are in the amber. Now, as for Zakynthos, yesterday we had 8 new infections recorded on the island. That it was a total of 126 for the week. The week before that, we had a total of 144. However, we are still in the red. So there has been a decline on infections. And again, I will keep my eyes on those numbers as the week goes on. Anyway, when it comes to deaths at the moment, deaths unfortunately in Greece have shot up again. Yesterday, I reported 69 new deaths here across the country. Today it's been recorded at 76 new deaths. You've got to remember we had 91 deaths the day before yesterday, which was the highest number since May the 3rd, and that was 91 deaths. So the death rate has kind of been up and down within the last few days. Anyway, that means the death toll since the pandemic started now has been 17,000. 313. 95% of those people had underlying health problems or diseases or were over the age of 70. And again, our condolences to those families that have been affected at this time. Moving on then to incubations at the moment. Now, incubations, interestingly enough, have taken a slight dip. Now, they were 594. At the moment, they are 590. Now, critical cases in hospital, of that 590, 359 of them were male, 231 of them were female. The average age of those people, 65 years of age, 83% of them having underlying health issues or other problems or over the age of 70. Now, regarding the vaccination status of those people, 490 of them were unvaccinated or are partially vaccinated, and 100 of them are fully vaccinated. Now, the thing is, those four from there, we don't know whether those four people got improved in their condition or whether those four people passed away. But it does mean that there's now 4 beds that obviously could take more patients if necessary. Once again, the ceiling number is 900 beds here in Greece that can treat people in an incubated status. Anyway, let's start looking at the news then. So today then, the new measures aimed at stemming the tide of rising infections and hospitalizations and fatalities from COVID-19 before Christmas, they go into effect today. Under the new rules announced by the Prime Minister and the government officials last week, people who have not been vaccinated against SARS-CoV-2 or do not have a valid certificate of recovery will no longer be allowed to go into public indoor venues such as cinemas, theatres, museums and gymnasiums, etc. Now, I'm just going to look at that in just a little bit more detail, just so that people who don't live here in Greece can understand the measures that are being taken here, and you can obviously compare those to wherever you are in the world at the moment. Now, it has been split into 3 stages, all right, just for clarity. So stage 1 at the moment is the areas which are accessible to all, whether you are unvaccinated or vaccinated, without any further measures other than the use of a mask. Now, those areas, they concern essential items such as pharmacies, food supply areas, supermarkets, butchers, fishmongers, bakeries, pastisseries, and even wineries. So at least you can still get a drink if you're unvaccinated. Anyway, stage 2, okay, areas are areas that concerns access to vaccinated or people who have been sick in the last 6 months and obviously have the relevant certificate to show that they have recovered from the disease, and also with a diagnostic test as well. Now, they concern businesses of retail, such as open restaurants. That means not indoor restaurants, but restaurants that are open, where you sit outside, you can still go in. Hairdressers, private and public workspaces, you're still allowed to go there. Education locations, and obviously you're allowed to go into beauty salons and places of worship. Now, citizens enter upon the presentation of a certificate of vaccination or a certificate of illness or a certificate of a negative or diagnostic test for coronavirus or PCR rapid test, which is 72 to 48 hours respectively before they can go into those locations. All right. Now, minors between the ages of 4 to 17 are allowed into those areas as long as they have a negative self-test within the last 24 hours before they are allowed presence in those areas. So we're talking about areas such as public workspaces, education areas. For some reasons, beauty salons are allowed on that list, and obviously places of worship like churches, etc. And also open restaurants, you can still go in if you have a PCR test, and it's only in the outside part of those areas that you are allowed in, not the inside areas of those. Now, then we have what they call the stage 3. Now, the stage 3 concerns access only for those who have been vaccinated or infected with coronavirus in the last 6 months and have their certificate, like me, of disease, as it has been nicknamed. And this concerns like entertainment venues, including indoor banquets, so you can still go to an indoor wedding. Music venues and bars, restaurants, cafes, internet cafes. Do they still have internet cafes these days? Museums, indoor monuments and venues for art and other art exhibitions, film screenings, theatres, conferences, gyms, and anything that is indoors, as they've written down here as well. Right, so that means if you have your vaccination certificate and you have your basically piece of paper that says you've had the disease and you've got over it, you are allowed entry in there. And it also goes on to say only people who have been vaccinated or become ill during the last 6 months are allowed to enter. Visitors enter upon the presentation of mandatory vaccination certificates or disease certificates. Now, minors from 4 to 17 years of age, 4 years of age, bloody hell, that's young, 4 years of age to 17 can alternatively submit a negative self-test statement within the last 24 hours before their presence is allowed into those sites. Also as well, I'm not going to go into too much detail on this, but working hours have also been adapted to limit the impact of rush hour on public transport. Not really so much of an issue here in Zakynthos, more in the cities, Thessaloniki, Athens, those type of areas, with retail stores opening at 10 a.m. In the morning and working shifts, so they can basically be open with 2 shifts running. And I do know, speaking to somebody yesterday, that some of the gymnasiums here have a special app where you can go into the gymnasium at any time you like, as long as you have your app and you scan it, you go in. Somebody said to me they were in a gymnasium at 1 o'clock in the morning working out. So again, amazingly, you can go to a gym here on a special app and go in and out as you please. Again, this is what they're doing to limit the impact of people meeting people. Although it'd be interesting, you're going to meet at 1 o'clock in the morning in a gymnasium, that is for sure. Anyway, big story now, which has taken the media nationally about Zakynthos. It seems the Archbishop of Zakynthos, Denialists IV, has suspended 14 priests who refused to be vaccinated on Saturday. The Archbishop has given a clear warning and has asked that everyone in Zakynthos' metropolis be vaccinated. That is like the parish of Zakynthos. He has permanently removed one of the 14 priests and given the rest a deadline until the end of the week to go and get vaccinated. The move by the Metropolitan or the Archbishop did not please everyone, however, and a small section of the island's population shared flyers accusing the Metropolitan of satanic acts and illegal and inhumane decisions. And I've got to be honest, I've not seen any of these flyers. I've not seen that. However, me personally, I still think it's kind of interesting that only just a while ago the church were one of the stalwarts of hanging out and not having or following some of the guidelines in regards to the COVID virus. Remember the stories last year of priests getting young children to kiss deceased dead bodies in churches, all of that scandal, and also priests saying, "Oh, Jesus will protect me from the virus," etc. And it's amazing that there's been literally a 360-degree turn by the Greek Orthodox Church here in regards to the vaccination, and they are fully behind the government by the sounds of it with mandatory vaccinations. It should be your choice. I still believe, I wonder what Jesus would have said about this, whether he would have mandatory called for vaccinations. But once again, let me make this very clear. I am not anti-vax. I am anti-mandatory vaccination. And let's please differentiate between the two. If you want it, go and have it. If you don't want it, it should be your choice, all right? Interestingly, the president of the Zakynthos Hospital Doctors Association, Nikos Patamis, has been referring to the serious staffing problems faced by the General Hospital here in Zakynthos. Once again, he stressed that the only solution to deal with the problem definitively is to increase scientific incentives so that doctors show an interest with the relevant announcements that are issued. You must remember at the moment They're trying to encourage, at the moment, the government is trying to get private practice doctors to go into public hospitals to help with the crisis that's going on in certainly in the northern parts of Greece. This has been going on. However, a lot of private doctors don't really want to go and work in there, and it's got to be made more attractive for them to do it. Now, the bottom line is this. Greece can notoriously put hospitals into a form of martial law where it is your duty to go and serve in the hospital. And if you are not doing that, then obviously you find yourself in trouble with the military for not going ahead and responding to that call, as it were, to arms. So anyway, he also went on to say the problem has not been solved. He said there is a big problem of understaffing in the hospital. He's talking about here. He says, remind you that only 38 doctors work while 89 are provided. We insist that the problem is not solved with patches, movements or graces here and there, and basically bringing in temporary doctors, basically putting somebody here and somebody there. He said what needs to be done is increase salaries and incentives for people to come and work so that doctors show an interest in any advertised positions that are here. Now, the announcements that were made on the 1st of November of the necessary ones that doctors still are not coming. They are not interested in minimum money they receive. And I was quite shocked. And he's written this in the local press, and you can go and read this for yourself. How much do you think a doctor here in Greece, on this island at least, from the Zakynthos Hospital, how much an hour that a doctor is earning, considering all the training that they go through, 7 years of training to become a doctor and all the exams you have to pass and all the other things, and also the cost of becoming a doctor, which are now, you don't get a scholarship these days, it's you have to pay out of your own pocket. I was quite shocked actually at how much a doctor at the moment, according to the head of the hospital here, is on. Get this, how much do you think? Have a guess, have a think now, and I'll tell you in a couple of seconds. And you'll go, sit down, I'm going to tell you now, €3.50 an hour. Yeah, that's right, not 3.5, 350 euros an hour, €3.50 an hour. That's what he's saying a doctor is on. He also went on to say the reason is economic, and also we are talking about an island area. It was in the centre, and with less money, maybe some places would be covered. And that's the thing. They have had problems with doctors being drafted into the island. Doctors are a bit like teachers. Teachers here in Greece don't always go to where they want to go. The teachers normally get sent by the Ministry of Education to where they are needed. So they might not want to be here in Zakynthos. The same with the doctors being drafted into areas they don't want to be at. And at €3.50 an hour, they certainly don't want to be here. So again, incentives have got to be better for those highly qualified people to actually want to come and work here. He was also asked to comment on the requests for the services of private doctors and specialists in pulmonary, pathology and general medicine that have to deal with the COVID-19 coronavirus pandemic. And Mr. Patamis stressed that this should have been done a long time ago. He also added that there was an assembly held for the transportation of seriously ill and incubated patients. As with the new provisos, doctors are now obliged to accompany patients regardless of their speciality. They have to accompany the patients to wherever they need to go. So if a patient needs to go to Rio near Patra, or a patient needs to go to Athens, the doctor has to go with them on that journey. So again, if doctors are going off and they're going to be away from the hospital for maybe half a day, even longer, then obviously that doctor is not in the hospital, obviously treating that patient or the other patients that are there. So he also added that the assembly for the transportation of patients is causing a problem, and he called upon obviously some changes to be made at the higher levels of of the government to see that these issues are being recognised. So there you go. That's what's happening at the moment at the hospital. Also, another little story that caught my eye was that judicial authorities here in Greece are now using the provisions of the new penal code regarding the dissemination of fake news to go after denialists who encourage people not to get vaccinated against COVID-19 or accept life-saving treatment. Now, in Thessaloniki, northern Greece, prosecutors are investigating a hospital supervisor who had apparently urged a 51-year-old COVID patient to resist incubation before she died last week. You might remember I covered that story. The probe was launched after excerpts of private conversations between the two were made public. In Athens, authorities are looking into more than 10 cases of COVID deniers disseminating misinformation on social media. And just again, I'd just like to make it very clear, if somebody is watching me maybe in Athens, I am not against vaccinations. I am against mandatory vaccinations where people do not have the right to choose what they put into their bodies, and they are told they will lose their job, they will lose payments, they will lose this, they will lose that, because they are not complying and having the vaccination. At the moment, I still say this, all those health workers that were working in the Greek national health system that were fired because they wouldn't have the mandatory vaccination, who had quite happily been working for over a year surrounded by people with the virus, working with people that were vaccinated. 90% of those staff were vaccinated, and quite happily working alongside somebody who wasn't vaccinated, that they should then lose their jobs, lose their livelihood, and to the detriment of the hospitals, who are still, at the moment, still trying to find staff and people to fill the roles that have now been left empty. So again, as I said before, why not start looking at those people's metabolisms and trying to work out why is it they don't seem to be contracting it while others are. So here endeth the lesson on that. Anyway, and finally, I didn't realise this yesterday, and I wish I had, actually. The Prime Minister, Mr. Mitsotakis, praised the men and women serving in the Greek Armed Forces with a statement released on social media to commemorate Greek Armed Forces Day, which occurred yesterday. He said that the men and women of the armed forces serve selflessly in all country fronts, tireless guardians of our national security, but also guardians of the everyday prosperity of our citizens. It read before stating that your dedication to your national duty fills us with pride, and we thank you. So to all serving people of the Greek Armed Forces, happy belated Armed Forces Day yesterday. I'm not sure if you had a parade or anything yesterday with everything going on with restrictions and everything else. I know there was a parade earlier in the year for 1821, which was a little bit hypocritical, Mr. Mitsotakis, who locking everybody down, but you still had your parade, so you could invite the Russians, invite the British and the French as well. Why? Arms deals being done, I would think, at the end of the day. Anyway, that's by the by. But once again, I'm going to keep my ear to the ground. Thank you to all those people tuning in on a Monday morning. Big shout out to Jeanette Cooney, also Gary Hipswell, Christine Wildridge as well, Andrew the Fridge Watkins over there in Wales, and obviously Amanda Gregory and Sean Bowen up there on the beautiful Exmoor. I don't know if you're out shooting again today or whether you're getting prepped for the next weekend shoot, but anyway, you take care and stay safe. Just a quick reminder, thank you to all those people that were in the chat area yesterday on beatsradio.co.uk for my Northern Soul show. Just remind you, if you missed it or you want to catch it again, it's been repeated on beatsradio.co.uk tonight at 7 p.m. UK time, which is 9 p.m. Greek time. Come and join me. I'll probably be hanging about in the chat area as I always do, taking requests and dedications for future shows. Right, that's it from me. Busy day ahead. I will see you later. You take care and have a lovely day wherever you are. And we're going to probably be doing cleaning. Catch you later. Ta-ra.